Hello, I'm Dr. Diana Chavkin here at SCRC Fertility. Thank you for joining me today for this IG Live. So March is Endometriosis Awareness Month, and many patients that I take care of for infertility do have endometriosis. Endometriosis is a disorder where essentially there are endometrial cells. So endometrial cells are cells that line the inside of the uterine cavity normally. Now, if those endometrial cells somehow implant and start to grow outside of the uterine cavity, that can cause some significant discomfort and pain, especially around the time of a woman's menses. Can actually cause pain throughout the month, sometimes during intercourse or actually during defecation. So unfortunately, these endometrial implants can really cause some significant discomfort and some disability for patients. It can create a situation where some women can't go to work because they're so uncomfortable and have to be on some significant pain medications. And it is a progressive disease as well. There are situations where these endometrial implants create inflammation. Again, these endometrial cells really normally should just be in the uterine cavity, and if they implant outside of the uterine cavity, it creates a situation where there can be inflammation and therefore can create scar tissue. So scar tissue is an issue when it comes to fertility, especially if that scar tissue starts to distort the anatomy. So inside the cavity, the abdominal cavity, the pelvic cavity, there's the fallopian tubes, there's the uterus, there are the ovaries. And in order for pregnancy to occur naturally, we need functioning and normal architecture. So we need, at the time of ovulation, the egg needs to get picked up from the ovary into the fallopian tube, and the sperm needs to meet the egg in the fallopian tube, and hopefully pregnancy occurs. But if there is distortion of the anatomy, a distortion of the architecture due to inflammation and scar tissue, then that fallopian tube can get distorted, and therefore can create a situation where the egg and the sperm can't meet anymore. And so that potentially can be an issue. And so endometriosis not only can cause discomfort and pain at the time of menses, and as I discussed, can create a situation where there's pain and discomfort after menses and throughout the cycle. It can also create scar tissue, which also can lead to discomfort, but can also lead to infertility due to distortion of the fallopian tubes, ovaries, and the architecture of the pelvic cavity. We also know that endometriosis itself can implant on the ovaries. So there are things such as an endometrioma. So an endometrioma is a cyst on the ovary that contains endometriotic cells. We often refer to it as a chocolate-filled cyst, and that is basically a cyst, a pocket of fluid that contains endometriotic cells, which replicate and grow and create a situation of pain, discomfort, but can also create a situation where the ovaries, the follicles, and the eggs are affected, which can affect egg quality. And that is an issue related to infertility. If there's egg quality and egg count affected by the endometriosis as well as architecture changes, it can lead to a situation where women with endometriosis may be at higher risk for infertility and a longer time to conceive. And so when people come to see me, part of the evaluation is getting a good history, trying to understand if they have pain with their periods, and if they do, we need to evaluate them for endometriosis. Some of the treatments for endometriosis would include a laparoscopy, where we put a camera inside the abdominal cavity, look inside the pelvic cavity, sometimes repair some of the adhesions, sometimes remove some of the endometriotic lesions. Sometimes that can improve discomfort. It can also improve fertility rates in some cases. But sometimes, even if the architecture is distorted and there is endometriotic implants in the pelvic cavity, one of the best treatments for fertility in those situations is in vitro fertilization, because in vitro fertilization allows us to take the eggs outside of the ovary, outside of the body, fertilize the eggs in the lab, increase the chance of fertilization and embryo development, and then once we have a normal embryo, putting that embryo in the uterus, so it kind of bypasses a lot of the potential pathology that may be a result of endometriosis. So it's important, if you think that you have endometriosis, or if you think you have infertility that might be related to endometriosis, again, this is a progressive disease, and so the sooner you can kind of get treatment, get evaluated, the better position you're going to be in for the future. I also do want to recognize, women with endometriosis, even who don't want to conceive. A lot of women, unfortunately, are suffering with this disease. And so I really want to, mention that. And I think it's important that we recognize this as a very, very serious disorder that can be debilitating for a lot of women. And we should, just encourage people to get help to improve the quality of their lives. So thank you for tuning in today. Any questions, thoughts, please feel free. I don't see any questions on the chat at the moment. Give it a minute. I see lots of waves, so thank you all for those of you who've checked in. Okay, well, I guess if there are no questions, please feel free to reach out to us. We're happy to meet with you in person or on a virtual consultation.